Hey everyone, today we are going to be talking about disorders of the circulatory system. Now, before I begin, I want to go ahead and start off by telling you that the disorders of the circulatory system are actually going to be broken into three different categories: blood disorders, blood vessel disorders, and heart disorders. And for your project, for your disorders of the circulatory system project, you're going to be choosing one disorder from each of those categories for your actual project. And you have until November 6th to complete this project. So it's a 2-week-long project because it will require a lot of research and information. So that's why you have such a long time period to complete it. So let's go ahead and get started and talk about different blood disorders. The first blood disorder we're going to be talking about today is anemia. And anemia is a condition in which you actually lack enough healthy red blood cells to carry the oxygen that your body needs to all of your tissues. And it can lead to a lot of different symptoms, and the symptoms vary depending on how anemic you are and per person. So in your central system, your central nervous system, anemia can lead to things like fatigue, dizziness, and fainting. And you can see on this image here, the things in red are the symptoms for people who have severe anemia. So fainting would be a symptom of severe anemia. In your blood vessels, it can cause things like low blood pressure. In your heart, it can cause palpitations, rapid heart rate, chest pain, angina, and even lead to heart attacks in some really severe cases. In your spleen, it can cause enlargement of the spleen. In your intestines, it can cause a change in your color of your stool or your feces. It can cause muscle weakness. It can cause shortness of breath, as well as paleness, coldness, or yellowing color of the skin and yellowing of the eyes. The most common symptoms in people with anemia, for the most part, are the feeling dizzy, the chest palpitations, and the muscle weakness, or the just seeming fatigued all of the time. I actually have anemia, but I have a very, very mild case of anemia. So really in me, my main symptom of anemia is I do have really low blood pressure. Most of the time my blood pressure doesn't get above like 100 at all. It's like 90/60 all the time. And then I do get occasional like palpitations and kind of fatigue, just feeling really tired. So anemia is just when you don't get enough oxygen to all of your tissues. Sickle cell anemia is very different, however. Sickle cell anemia is an inherited group of disorders where the red blood cell is actually contorted into a different shape. It kind of looks like a half moon shape. And so the cells tend to die earlier, leaving a shortage of healthy blood cells. And this can block the blood flow, causing pain. Sickle cell anemia is most common in African Americans, or it's more common in African Americans than it is in other populations. We don't really know why that is. That just seems to be an inherited gene in that population of people. And so with sickle cell anemia, instead of having a round red blood cell with a little disc, they're kind of like crescent moon shaped. And so with less surface area, they're able to carry less oxygen. Embolisms and thrombus are very easy to get confused because they're similar, but the difference is that an embolism is an obstruction of the artery that's typically caused by a moving clot of blood or an air bubble, whereas a thrombus is a clot that is formed within the blood vessel that does not move. So if you were looking at a blood vessel and you had a clot that was moving through and then it got to a narrow portion and it got stuck, that would be an embolism, versus if a clot starts to form on the lining of an artery and it builds up over time, that would be a thrombus. But either way, they're both types of blood clots. Hemophilia is another genetic disorder, a disorder which causes the blood to not clot properly. It's linked to, it's sex-linked hereditary disease, which means that it's transmitted genetically to females by their sons. So you can see here on this image, a father without hemophilia and a mother who is a carrier. So she's not showing any symptoms, but she's a carrier of the hemophilia. If they were to have 4 children, they would have 2 that do not have the disorder, 1 that is a carrier, and this son would have it. If the father with hemophilia or if there was a father who had hemophilia and the mother who was not a carrier, and they were to have 4 kids, then you would have 2 children that do not have it, and 2 that are carriers. So it's specifically transmitted genetically to females by their sons. So now we're going to be looking at blood vessel disorders. So the first blood vessel disorder we're going to be looking at is an aneurysm. And an aneurysm is an enlargement of an artery caused by weakness in the arterial wall. It kind of starts to form like a balloon shape. And eventually, an aneurysm, if it builds up enough pressure behind it, it can actually lead to a rupture, which in some cases can be life-threatening. Some aneurysms do show symptoms while others do not, and you can actually go for a long time not knowing that you actually have an aneurysm building up. The picture here is showing a brain aneurysm, which is one of the most deadly types of aneurysms, but you can actually get aneurysms in many different parts of the body. And if they rupture, this leads to internal bleeding that has to be treated immediately. Coronary artery disease, or CAD, is actually a combination of both arteriosclerosis and atherosclerosis combined. So arteriosclerosis is the thickening and the hardening of the walls of the arteries, which typically occur with old age, versus atherosclerosis, which is a disease of the arteries that is characterized by a deposition of plaque of fatty material from the inner walls. So atherosclerosis is a kind of a buildup of fatty plaque within the arteries, and this can be prevented with lifestyle changes and diet and nutrition, versus arteriosclerosis is a thickening or hardening of the arteries, typically caused by old age. Cerebrovascular accident, or CVA, is a fancy word for a stroke, but there are different types of strokes. The first one is transient ischemic attack, or a TIA. This is a brief episode of neurological dysfunction which results in the interruption of blood supply to the brain, and typically a TIA is described as a mini stroke. An ischemic stroke is the most common type, which is usually caused by a blood clot that blocks or plugs a blood vessel in the brain. An ischemic stroke is when someone says they had a stroke, this is what they most commonly are referring to. So a blood clot has traveled from somewhere in the body up to the brain and caused a blockage of that blood vessel. So now the brain is not getting enough oxygen and it leads to a stroke. An hemorrhagic stroke is caused by the rupture of a blood vessel in or on the surface of the brain while the bleeding, and then it starts to bleed into the surrounding tissue. So hemorrhagic is specifically when a blood vessel in the brain ruptures. So it's not really a blockage, it's an actual rupture. And this is also sometimes referred to as a brain bleed. Here are the signs of a stroke. You'll hear the acronym FAST every time that you hear someone talk about stroke. So the F stands for face, which means that you ask the person to kind of smile, and you can look and see is one side of their face drooping. Arms for A means you ask the person to raise their arms, and if one arm is not being able to be raised as high, or if they're not able to raise their arms at all, that could be a sign. S is for speech. So you ask the person to say like a very simple sentence like the sky is blue, and you listen to hear if they have any slurring or if it's difficult for them. And then T is for time. And this is important to remember because when it comes to dealing with someone with a stroke, you need to call 911 right away, because the sooner that a person who's experiencing a stroke receives medical attention, the better the outcome is going to be, and the more likely they'll be able to recover. Peripheral vascular disease, or PVD, is a progressive circulation disorder where the blood vessels in most commonly the legs, are narrowed, and it causes a blockage. So typically with peripheral vascular disease, we'll see a lot of swelling in one limb or the other. This can happen in other parts of the body, but it's very common to see symptoms in the legs. Hypertension is another name for high blood pressure. It can lead to severe health complications and increased risk of many other circulatory disorders such as heart attacks, strokes, and even increased risk of death, depending on how high the blood pressure is. Blood pressure is the measurement that we use that is based off of the force of a person's blood as it travels against or through the arteries. And we measure blood pressure. We're going to be learning about that tomorrow, but you measure blood pressure by listening for a systolic and a diastolic pressure. Systolic is measured during the contraction phase, and then diastolic is measured during the relaxation phase of the ventricles. And we'll learn more about that tomorrow when we start our blood pressure skill. But as we're talking about blood pressure, you need to know, well, what is normal and what is considered hypertension? So normal blood pressure is anything that is less than 120 over less than 80. Technically, 120 over 80 is considered elevated. So we're looking at anything less than 120 and less than 80. So if that person's blood pressure was 124 over 80, they would be considered elevated. Elevated is not hypertension. It just means that maybe they're anxious about something, or maybe they need to just get a little more exercise to bring that down. High blood pressure or hypertension, there's actually two stages. There's stage 1 and stage 2. So stage 1 of hypertension is anything from 130 to 139 or 80 to 89. This means if a person's blood pressure, sorry, my alarm's going off. This means if a person's blood pressure is 132 over 90, then that would be, I'm sorry, this means that if a person's blood pressure is 132 over like 74, well, the 74 is less than 80, but because they have that 132, they are still considered hypertension. If their blood pressure was 136 over 82, that would be within those realms for hypertension stage 1. If their blood pressure was 124 over 84, because they have that number that's over 80, they would still be considered hypertension stage 1. Hypertension stage 2 is anything that is 140 or higher or 90 or higher. So that 136 over 90, because of the 90, they would be considered stage 2 hypertension. And a hypertensive crisis is anything that's higher than 180 and or higher than 120. And we're going to be practicing this some more over the next few days and getting you used to looking at this chart and measuring blood pressure. But this is a very important skill that you do all the time working in healthcare, and you need to be able to have this memorized, this chart, especially if you ever are working with cardiac patients. Next, we have varicose veins, and you've probably all seen what varicose veins look like before. A varicose vein is a vein that has been enlarged or twisted and often appears as a bulging blue blood vessel that is very clearly visible through the skin. Some cases, varicose veins do look as severe as this image on the screen, and in some cases, it just means that their veins are more visible, maybe on the back of their leg. Prevention for varicose veins includes things like wearing sunscreen, elevating your legs when resting, wearing elastic support stockings, eating fiber or high fiber diets, exercising, and maintaining your weight. But typically, varicose veins are very common in older adults, especially women. Okay, and lastly, we're going to be talking about heart disorders. So first we have angina pectoris. Angina pectoris is a condition where you have severe pain in the chest, which is also often spreads to the shoulders, the arms, the neck, and it's caused by an inadequate blood supply to the heart. Typically, angina pectoris is also a major symptom of a heart attack, or it could be a symptom of an oncoming heart attack. Did I go too far? No, okay. Sorry. A heart murmur is an unusual whooshing sound that may be innocent, or in some cases it might reflect a disease or a malformation. So there are heart murmurs that are completely normal. For example, I don't even remember what it's called at this point, honestly, but I went to the doctor back in February or March of this year, and they were like, "Hey, did you know that you have like a double heart sound?" And I was like, "What are you talking about?" And they told me that basically one of my valves in my heart just closes like half a second slower than another valve, and so it causes like a double heart sound. Which is a completely normal heart murmur that's not going to cause any major problems, but just something interesting. But then there are heart murmurs that can be a symptom of a disease. So we use a stethoscope in order to detect the most heart murmurs, and you're going to be using stethoscopes to measure blood pressure and things, and you could definitely use a stethoscope to listen to your own heart while you're practicing. Okay, so next we have different arrhythmias. So an arrhythmia is a change from the normal heart rate or rhythm. So really anything outside of the normal is an arrhythmia. Bradycardia means a slow heart rate, which is less than 60 beats per minute. And tachycardia is a rapid heart rate, meaning more than 100 beats per minute. So if slow is less than 60 and fast is more than 100, normal is anything between 60 and 100. So a 66 beats per minute heart rate, 72, 84, all of those are within normal range. And just because you have a slow heart rate or a fast heart rate does not necessarily mean that you're sick or that there's something wrong with you. Athletes tend to have slower heart rates because their hearts are more adapt to functioning under high activity levels. And some people who have like anxiety or just tend to be very anxious may have faster heart rates, or if you've been up moving around, your heart rate is obviously going to increase and then it will eventually go back down. Now, if you have a rapid heart rate all the time for extended periods of time that's very fast, then that could be a symptom of something being wrong. An irregular heartbeat is just a change in the heart's beating pattern. So, for example, my like double heartbeat thing that happens in mine would be considered irregular, but that doesn't necessarily mean that there's something wrong. Congestive heart failure, or CHF, is a condition that occurs as a result of impaired pumping capability of the heart and is associated with abnormal retention of water and sodium. So it basically means your body is holding in too much water and too much sodium, and then the heart is not able to beat at its proper rate or be able to contract fully. CHF results from inadequate or decreased cardiac output, which causes an increase in blood volume within the vascular system. So the resulting congestion within the venous system interferes with the movement of body fluids, resulting in the fluid accumulation in the tissue spaces called edema. Edema is basically a fancy word for swelling. So when the body is holding in too much water and too much sodium, that causes an overflow in the blood vessels, meaning that now the vessels are not able to pump the amount of blood that it needs to get throughout the body because there's too much other fluids taking space. So then we start to see swelling in the limbs, especially the legs, and in the face, where we're trying to send that water somewhere else in the body so that the heart can compensate and be able to pump properly. Congestive heart failure eventually leads to death if not treated, because slowly your heart is not going to be able to keep up with the needs of the body and it will eventually just stop working. Lastly, we are going to talk about myocardial infarctions, or MIs. And a myocardial infarction is just a fancy name for a heart attack. And it's when a heart attack is basically a life-threatening condition that occurs when blood flow to the heart is cut off very abruptly, causing tissue damage, and then your heart is not able to function properly. Heart attacks are not deadly on their own. In some cases, they can be, but most of the time people actually have heart attacks. They are able to recover, but because now you have had tissue damage to the heart, you have to be very careful, take certain medications, change your diet, change the way you exercise in order to protect your heart and prevent having another heart attack. People who have had one heart attack are at higher risk for having another. So it's very important that if you have had a myocardial infarction, that you take proper measurements to prevent a heart attack. In some cases, depending on the cause of the heart attack, there may need to be surgery. They may need to put in a stent to help open up the blood vessels. There are lots of different things that they may have to do in order to prevent that from happening or to help you recover from having a myocardial infarction. And then there's my resources. So that is everything for disorders of the circulatory system. So now I want you to go ahead and you have a video that I need you to watch about your project and a Google form that you need to fill out regarding your project as well. And I need those Google forms turned in as soon as possible so that I can make sure you have everything you need to do your projects. If you have any questions, feel free to text me or email me, and I will be having some like open office hours this week and stuff so that you can stop by and get help on your projects if you need them. Otherwise, I will see you all later. Have a great day.